when a child has pain in the ear, it's usually from fluid putting pressure on the tympanic membrane or the eardrum. And the eardrum is sealed off, and unless it bursts, that fluid can't get out, and you don't want that to happen. Yeah, but it's supposed to drain naturally back down through what's called the eustachian tube. But if that eustachian tube gets swollen and inflamed because of allergies, other kinds of inflammatory reactions, then that fluid gets trapped and it's got nowhere to go.
Okay.
And once that fluid is there, it's a nice, warm, wet place for bacteria and viruses to grow, and they just love it. So if we can keep that fluid away, keep the fluid drained, then there's no place for that bacteria and virus to grow.
So you're saying if the eustachian tube is swollen, then the fluid stays up here in the ear.
Exactly.
Now the eustachian tube connects the middle ear, correct me if I'm wrong, the middle ear where it gets infected to the back of the throat.
Exactly.
Right.
And in children, young children, that eustachian tube is more flat.
Okay.
And so it doesn't drain real easily. As we grow, the eustachian tube becomes more vertical, so it drains more easily.
Now, okay, I get that, but the scientists have found bacteria in that ear effluent stuff. There's bacteria in there. Why wouldn't you want to treat it with antibiotics?
Well, you know, the throat's not a real clean place. The mouth, we have lots of bacteria in that region, so it's not surprising. If a child lies on their back and takes a bottle, a lot of that fluid is going to go wash up into the eustachian tube, and the bacteria is going to wash up there with it.
So are you saying that it's kind of a mechanical problem or an anatomical thing that ends in a bacterial infection, and if we intervene sooner or in a different way, we won't need to use the antibiotic?
Exactly, Richard, exactly. And you know, you and I are fortunate because we went to osteopathic medical school. So
gave us a different perspective.
It did. It taught us how to use our hands. It taught us how to look at things a little bit differently. And the concept, the philosophy of osteopathy is the body has an ability to heal itself if we give it what it needs, take away what it doesn't need. If they're in a lot of pain, there's probably fluid there, and you can go to the doctor, and most pediatricians have what's called a tympanogram, which is a device that they put in the ear that measures whether there's fluid. But there's also a home tympanogram available, and I think it's just the greatest thing because it's called an ear check. And what it does,
graphics up.
Yeah, the parent can actually put this in their child's ear.
Well, that just looks like the thermometer that you do in the ear, only it's bigger.
Yeah, but it actually measures the fluid.
You want to see if I have any fluid?
Yeah.
All right, here we go.
So tell us again the purpose of this.
We'll see if I have any fluid in my ear.
You do have a little bit.
You know, and I do.
She does. She
I
has
have allergies, and I kind of, I do.
So what does this do? Help me understand again. What's it do now?
It measures the pressure, so it gives you an indication that there's fluid behind that eardrum. And if there's fluid behind the eardrum, down the road, there's most likely going to be an infection because that's, as we mentioned earlier.
It can't drain, it's building up, and it just starts festering.
Exactly.
Okay, now, you've given us an alternative way to approach this, but really what is wrong with taking an antibiotic? I know we covered that, but this is so important. What can go wrong with that?
Well, there's a lot of reasons why we shouldn't be giving antibiotics to children for ear infections. First of all, the medical literature has published for years. I mean, at least 15 or more years ago, I found 2 articles that showed that the sooner you give an antibiotic for an ear infection, the longer they'll last and the more recurrences you'll have. That's what the medical literature indicates. And you know what? It makes sense to me. Think about it. If our body can heal itself, but and our immune system is learned, we have to actually get sick in order to have a really strong immune system.
Yeah, got to be exposed to something.
Yeah, I mean, and so if you give an antibiotic the instant somebody gets sick, then their body never learns how to handle that. You let the antibiotic handle.
Okay, we've got fluid in the ear. So now our good doctors have come up with another treatment. Let's just put a tube in that ear. You know, it's going to drain it.
That's what we hear.
Is that the way to go?
I don't believe it is. And this is the reason. First of all, it puts a hole in the child's ear.
Yeah, that's not good.
And the concept is if we put the tube in the ear, the fluid will drain out. But that's not how the fluid is supposed to drain out. It's supposed to drain down the eustachian tube. putting a hole in the ear, think about it. You know, women who have a pierced ear, when they keep that earring in there, it creates a permanent hole. And sometimes children do end up with a permanent hole in their ear. If the tube is in there a long time, they can also develop scarring. And if that scarring occurs, they can have permanent hearing loss.
The fluid is not an infection at that stage, right?
Exactly.
So
Yeah.
just because we have fluid behind the ear, we don't rush and give antibiotics. We need to do the treatment you're about to show us
Exactly.
to release the fluid.
What about the child who has been the typical route? They've had, 12 rounds of antibiotics in 3 years for these. Are there other things you'd want to fix or buff up or help correct in that kid?
I can't tell you how many children I've seen that next week they were getting tubes put in their ears.
Yes. Right.
And we were able to cancel that surgery because in literally 1 week we got resolution of their ear problems.
In 1 week?
Yes.
Okay.
How would you do that?
I thought it's a multifaceted program, but it's basically, first of all, removing all the dairy, 100%.
Okay.
Secondly, I teach the parents how to do a very gentle osteopathic manipulation.
So this isn't popping the neck?
No popping
none
and
of that.
cracking.
It's
No,
gentle.
it's
Okay.
very gentle, almost like a massage.
Yeah, okay.
Kids love it, and it drains the fluid from the ears.
Oh.
And I do a regular tympanogram, and then I go in and do this massage, go back into the tympanogram, and most of the time you can already see that quickly, 5 minutes.
Really?
You can see the fluid starting to drain.
Well, is
from
the
ear.
instruction on how to do this
how do
massage
we know
on
to
this
do
video?
this?
It is. It's in the Treat Ear and Respiratory Infections Without Antibiotics video.
So this is such a
That will tell
problem
us how
that
to
you've
do
worked on. You've really worked on this for years to perfect this method. Tell us what you have to help the folks at home, because I know this is going to help a lot of families.
The video goes into a lot of details about the studies and the research, and then it shows them.
This is a video?
This is a video.
Okay,
It
go
shows
ahead.
them how to do the massage at home.
Good.
And so a lot of times the parents can even choose not to even see the physician, because if they do this quick enough, the resolution occurs before they even get to the doctor.
So we open up the eustachian tubes and we drain out that fluid so no infection can set in.
And in addition to draining the fluids, this type of lymphatic treatment has been shown in osteopathic research to actually improve the immune system's functioning.
Oh, that's
Okay.
wonderful.
And so,
Lymphatics,
when I first started practicing, was still kind of cautious about not giving an antibiotic for an ear infection. I'd see a child with this blazing red ear infection, high fever, and I'd give them the antibiotic, but I said, don't fill it until you've done this treatment twice.
Yeah.
At home, and I never had anybody fill that antibiotic.
Is that right? Well, let me get this straight. Does anything else come with this, or how do you offer this?
Yes, it
Help
comes
us
with a little
understand.
booklet, too, that gives some of the information
Okay.
and a visual of how to do the treatment. And then the ear check, which is the home tympanogram
So
system.
you can tell your progress.
Yes. So first of
Perfect.
all, you can see if you need to do the treatment, and then you can follow your progress and see, is my massage OMT, is it working well?
Okay.
Do I need to do it more often,
Okay.
or has the treatment worked?
And is your website blockcenter.com?
Correct.
I
Yeah, do we
remembered
have
it
that
from
up?
last time.
Blockcenter.com.
Blockcenter.com.
This is a great way to help the kid get through that and on to a healthy life.
The thing I want to mention is osteopathic manipulation like this can be really beneficial during the flu season.
Okay.
Back in the early 1900s, when we had the terrible swine flu epidemic, where literally millions died throughout the world, patients who had osteopathic physicians who did manipulation on them survived in much greater numbers.
This is a good idea, folks. If your family is struggling with earaches and the little ones, I'd get a copy of this and put these principles to work.